our healthcare system is irrevocably broken. And yet there's this stubborn refusal to address it by our elected leaders. Why? First of all, this is Unbelievable Reality Podcast, and I am Roy Arthur. As usual, before we dive into some latest news on the healthcare debacle, I wanted to mention a literary reference. I don't know if I mentioned this before, but I'm kind of a self-made person, self-made man. My knowledge base is really based on the fact that I've been a voracious reader my entire life. Starting from when I was a little kid, I got mono way back in the day. I'm not going to tell you how far back that day was, but it was a long time ago. There was nothing to read in our house at that time because I lived with my mother and we were pretty poor. But somewhere along the way, she bought a copy of the Encyclopedia Britannica, and I believe I was in 8th grade at the time, and my sister bet me $20 that I couldn't read the entire thing, and I did. Now, I have a head full of nonsense and things that really don't matter, but boy, was that a struggle. Since I was home for a month with mono, though, I had ample time to do that. This was back in the day that we only had 4 to 8 television channels, if you were lucky, and it depended on what direction the rabbit ears were pointing to. I just dated the shit out of myself. Anyhow, so I've been fascinated by American history, real American history, not the made-up bullshit that's taught in schools, but the real truth of the growth of the United States of America. It is a horrific story, just to let you know. But of late, I've been kind of focusing on the Lewis and Clark fact-finding mission, which is glamorized into this grand expedition to go see what was out there. We kind of had a pretty good idea of what was out there before they went for their long march. And they had a lot of help from the native populations along the way, along the Missouri River, all the way into Montana, and then of course the Nez Perce when they crossed Oregon and Idaho, and etc. They also shared a great gift with them, which was venereal disease, i.e. gonorrhea and syphilis. I'm sure the natives thanked them for that later. But prior to Lewis and Clark, there's a book I'm reading right now by Shirley Christian that's called Before Lewis and Clark, and it's all about the Chateau family who was responsible for the founding of St. Louis, otherwise known St. Louis, Missouri. If you are a podcast follower, you will note that I reference St. Louis, which for some reason has so much to do with American history. It's wild. From another book called The Broken Heart of America, The History of St. Louis, and all of the racial strife and tensions that are inherent with, for some reason, St. Louis, Missouri. Don't ask me why. Anyway, I'm diving into this right now. It's called Before Lewis and Clark. If you are an American history buff, this is factual. This is all about the French and English fur trade going on pretty much from about the 1600s, early 1600s, until basically they ran out of beaver to kill. That would be probably about 1825, 1830 at the latest. And then we trapped out all of North America. Isn't that exciting? But anyway, I find this interesting, so I said, fuck it, I'm going to read it. So, back to healthcare. Just recently, United Healthcare was sued by the federal government for Medicaid fraud. And basically what they've been doing is lying about claims and charging Medicaid and Medicare and getting paid for claims that didn't exist. Lo and behold, right before the suit was made public, the CEO up and decided, this is the recent CEO, who'd only been there for 6 months, up and decided that he was going to quit. Go figure. And take his $10 million and leave. The reason I reference this is to a couple of points. Obviously, healthcare was a big deal when the CEO of United Healthcare was murdered in New York, 3 months ago? Does anybody remember that? Does anybody remember Luigi? We don't talk about it anymore. I'm not taking a position on that actual act. I don't believe that there's any circumstances where assassinating a CEO of a business is appropriate or in any way acceptable. But it raised the healthcare issue, and then boom, in our 24-hour news cycle, it's gone. But it's not. And it's about to get a lot worse. If this big new beautiful bill that is supposedly sitting in front of the Senate right now goes through, the cuts to Medicare, Medicaid are going to be astronomical. Not including the cuts to our national parks, Department of Energy, Health and Human Services. I mean, just pick any division of the government, any agency of the government, Environmental Protection Agency, they're all gutted if this bill goes through. They're all gutted. And now, will that affect billionaires? No, fuck no. They can just get on their yachts and leave. Will it affect you and me? Abso-fucking-lutely. And the reality here is in this country is our healthcare system is irrevocably broken. There's no fixing this. And yet there's this stubborn refusal to address it by our elected leaders. Why? You already know the answer to this question. It's really simple. It's called money. In previous podcasts, I've talked about even with the Affordable Care Act, support from that, an average family of 4 can expect health insurance, just the insurance, to cost somewhere in the neighborhood of $1,000 a month. And that is with a $5,000 deductible. And that insurance only works 100% if you go to in-network providers. Now, I want to reference this. This is really important. In-network providers. Do you remember all of the propaganda around the Affordable Care Act? And one of the big selling points of why we shouldn't do it was you wouldn't be able to pick your own doctor? Does that sound fucking familiar now? If you don't go in network, where you don't pick your own doctor because you have to be in the network to get coverage by your insurance, you decide to pick a doctor that's out of network, it doesn't get paid for. Do you see the lie here? Here's a couple of examples, because I mentioned dental insurance as well. I recently had to have an implant. If you have children, for God's sakes, do the best you can to provide the best preventative dental care you can. Teeth are something that we cannot replace, and a life of having bad teeth is an absolute nightmare. I've lived it. I lived it all my entire life. I never had dental care until I was out of high school. My mother never took me to the dentist. We had no money to go to the dentist. It was never even talked about. So by the time I first went to a dentist, I believe I was about 19 years old. I had like in excess of 20 cavities. And I had to end up having so much work that I lost numerous teeth. Anyway, the moral of the story is this. I recently had to have an implant. In the United States of America, an implant, one tooth, costs $5,000. If you get a cheaper deal, it's $3,500. Between $3,500 and $5,000 for an implant. And your insurance won't cover it. Because even though we've been doing dental implants for 40 years, dental insurers still call it experimental treatment because they don't want to fucking pay for it because it's so expensive. So the only people that can afford to have implants are wealthy. Now, that says a little bit about me. It's true. I have above average income and above average net worth, so I can afford to do that. The majority of people that lose teeth end up with dentures. The long-term health implications of that are astounding and horrific. But that's your option. And not to mention that most dental insurance plans cap out somewhere between $5,000 and $10,000. And that dental insurance plan will cost you somewhere in the neighborhood of $150 to $170 a month if you're an adult. Now, if we went into median per capita income in the United States, which is approximately $57,000 a year gross before taxes, just do the math on $1,000 a month for health insurance. Okay? Another part of the health insurance scam in this country that is so mind-boggling is the prices that the hospital would charge you. My wife happens to have epilepsy, and that was just discovered a couple years ago. The horror that I went through with an insurance carrier that I will not name, but it starts with an A, to get her claims paid was unbelievable. Took an entire year of constant phone calls, constant harassment, because here's something that you don't know, and share this with your friends. The health insurance companies, when you file a claim at a hospital or a doctor, before it even gets to United Health or Allstate or Kaiser or anybody, by the way, Kaiser is the best health insurance in the US as of this moment because they only deny 7% of their claims, whereas United Healthcare denies 29%. Sit with that fucking for a moment, okay? But before it even gets to those guys, it goes through a third-party program that's AI-driven. And the algorithm tries to find ways to deny the claim. That third-party company is hired specifically to deny claims. So you think you go to the doctor for whatever, your checkup, you got whatever the fuck is wrong with you. You think your insurance is going to pay for it. You find out a month later, your claim's denied. Period. They'll oftentimes claim pre-existing conditions. That's the go-to. My advice to you is fight like a son of a bitch because you'll have to. Eventually, you will get that claim paid. But you have to be planning on that taking a long time. And in the meantime, now that the Biden administration got rid of health claims on our credit reports. That was a big deal. The majority of American bankruptcies are caused by health bills, by medical bills. The majority of 90% of bankruptcies in the United States are because of medical bills. That people didn't have insurance, were underinsured, and they just simply couldn't afford to pay it, or their insurance ran out. 90%. Think about that for a minute. But anyway, I got these claims paid, but it took a year. And they tried every trick in the book to claim pre-existing condition, even though it wasn't diagnosed. And when it was diagnosed by the Mayo Clinic. Okay? And they still refused the diagnosis. That's one thing. Second thing is, I found it interesting that they sent us two sets of bills. They sent us the bill that they sent to the insurance company, and then they'll send you another bill if you self-pay. The difference between the two is 60%. That's right, 60% more for it to go to the insurance company than if you pay cash out of pocket. How can that be fucking possible? I mean, an appendicitis is an appendicitis. Why does it cost more if it goes to your insurance company than it does if you pay out of pocket? It's the same fucking surgery. But that's part of the healthcare game here. Let me give you an example of why this system will never be fixed and how easily it could be fixed. It could be fixed so easily. Do you realize that we're the only first world country in the world that does not have socialized medicine, otherwise known as healthcare for all? The only fucking one. And the only reason that we are the only one is because it's big business. And the people at the top of those corporations, once again, capitalism run amok, greed out of control, are making millions and millions and millions of dollars every year. That is why we cannot get a change to healthcare in the United States of America. Because these corporations make so much money, they spend millions and millions of dollars every year lobbying, otherwise known as paying off, our congressmen and our senators to vote down anything that remotely threatens our destroyed, broken, inept, horrible healthcare system. The United States currently ranks 37th in the world in infant mortality. We are supposed to be the wealthiest country in the world, but Rwanda does a better job with babies than we do. We have the 14th highest rate of women dying while giving birth. Do you want to explain that? I surely as fuck cannot. I know this for a fact because I just had somebody have a baby. Topic for another podcast when I go into women's health care. Don't even get me started in this one. But I'm going to give you another reference. My daughter lives in Berlin, Germany. In Berlin, Germany, of her paycheck, approximately 43% of it goes to taxes. Okay? Part of that taxes is for socialized medicine. Okay? Her monthly premium for her health insurance is $100 a month. My daughter fell off a stage at a concert 3 years ago in Germany and broke her neck in 3 places. Literally came within a millimeter of being paralyzed for life. She had to endure 3 surgeries, have 2 plates and 8 screws put in the vertebrae of her neck for her to function and live and lead a normal life. For that surgery, it was so delicate, the #1 surgeon in the country performed the surgery. She was in the emergency room for 18 days, in ICU, intensive care, for 14 of those days. In the United States of America, that bill would have been $750,000. $750,000 with a 50% chance of success. When it was all said and done, in the country of Germany, her final bill was 183 euros. This is a true story. I am not making it up. It was one of the most terrifying, horrific experiences of my life. The scars are still on her neck. I see them every time she comes home for holidays. But think about that. Think about that. If that would have happened in the United States, 50-50 that the surgery would have worked, and this entire family would have been bankrupted forever. That's the insanity. When we live in a country where it's $500 a month for insulin, but you can buy insulin in India for $5, there's a problem. When you can get an implant in Mexico for $600, that's just as good as the implant that you get in the United States at your dentist for $3,500 or $5,000, what's wrong? And nobody wants to touch this. Our healthcare system is only getting worse and will continue to get worse. And if you have personal experience in it, if you've been told you're out of network and you just got a surprise bill, your insurance doesn't cover it, you have a pre-existing condition you're totally unaware of, fight back in any way you can, all the way up to, and if you can afford an attorney. That's the only way you'll get your claims paid, because the system is set up to deny. And I wonder to myself, what is going to happen to the 14 million families, not people, families? Multiply that times 4. It's an average of 4 people per family in the United States of America. Fucking Google it. What is going to happen to those families when the federal government cuts off their Medicare and Medicaid, and then has the balls to say that employer based healthcare is gonna pick up the slack, when all an employer has to do is you work less than full time, you don't qualify for employee healthcare. And if you're a small business, like I used to own a publishing company, a magazine publishing company, where I had 6 employees, I had no legal mandate to provide health insurance, nor could I possibly afford to do so. The majority of people that work in the United States of America work for small businesses that aren't required to provide health care. It's a lie. It's a scam. And it's another way for the rich to get richer. That's all. Healthcare in the richest country in the world. Oh, by the way, we're $37 trillion in debt. So I don't know how we can call ourselves the richest country in the world. That seems like an oxymoron to me. Topic for another podcast. But healthcare in this country, if you haven't been to the doctor lately or the dentist, fucking get ready. And also for all these people that aren't going to lose their coverage, my heart goes out to you. Because people are actually going to die. Because they won't be able to get treatment. They won't try to get treatment for illnesses that if they stop, they wouldn't progress and get worse, etc., etc. And people can't afford their medications, on and on and on. This is an unbelievable reality to me, that we live in this country, the United States of America, that's leading the world in innovation, technology, etc., 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 all this fucking shit. But we can't even provide basic health care to all of our citizens. We can't even protect mothers that are going to have babies, and we can't even protect the babies that are being born. How fucking unbelievable is that? Once again, it's Unbelievable Reality Podcast. I'm Roy Arthur. Follow me, TikTok, Instagram, Substack, Spotify. Feedback, questions, comments, love to hear them. Give me a topic to talk about and let's see what I come up with. See you next time.